Hi, welcome to the Pharmacy Lounge podcast, episode 1. In today's podcast, we will kick off with a few interviews. First one will be Siddiqur Rahman. He will be talking about the COVID crisis and how it's affecting GP practices down south in Kent, where he works. Now, with it being our first episode, there's obviously a lot to talk about. We've been planning this for months now, and we finally got it up and running. A lot of planning went into it. We wanted to cover a lot of different areas, and we've got hopefully a lot of things in place to make this podcast really interesting, informative, and hopefully useful to all pharmacists and even non-pharmacists that might be listening or watching the videos. So we're obviously in the middle of the COVID-19 crisis. The whole world is in a crisis right now, but hopefully there is light at the end of the tunnel. There's a lot of people that are sacrificing their life, their health, and putting their loved ones at risk. And kudos to them, guys. They're really going out there and working really, really hard. We have to just do everything we can to support the NHS in this critical time. Thousands have died and thousands more will die. That's one thing we know, unless we can find a miracle cure for this. There are drugs that are showing promise, that are promising in this fight against COVID-19. Hopefully they will come into the market soon. But until then, the best thing we can do is stay home. And if you're a healthcare professional, if you're a key worker, obviously, take every precaution you can. Your safety is paramount. If you're not safe, if you're ill, you can't work. So you need all the safety equipment that you can get hold of, and hopefully companies and the government will try hard to give you all the PPE that you need. But so the main thing is for now the safety of yourself when you're working out there. So for our first interview, what we'll do is we'll have a series of interviews over this episode and the next coming episodes. So right now we have Siddiqur Rahman, who I interviewed earlier, and you'll hear him speak about the situation that they're facing in the GP surgeries. We also have interviews coming up from Gary MacDonald, who's a respiratory consultant up in Scotland. He's a pharmacist as well. He's got a lot of experience in the respiratory care side. We also have a number of contractors around the country who will be giving their side, independent contractors, telling us how they're struggling and how they're working to support their community, their patients, and the team as well. And from what I've seen over the past few weeks, the independent contractors have really, really gone out of their way to support their team with as much mask and hand gel and protection as they could get hold of. Whereas we've not really seen that much support from some of the bigger multiples and the bigger companies. Really hope we can get more of that for pharmacists that are working in these bigger companies. They need all the support they can get. And especially the staff as well. They do need the support of at this critical moment. So, without delay, we'll have Siddiqur Rahman in Kent. Siddiqur, what's your situation out there? You have been working in GP practice for a while now, and you've been there from the beginning of this crisis. Tell us a bit more about yourself and what you're facing.
Okay, so I'm a GP pharmacist. I do also work in community pharmacy during the weekend at times as a locum. Obviously, since the crisis beginning is obviously just like community pharmacies, we're taking each day as it comes, and also we're starting to see sort of panic mode coming in terms of patients ordering the repeat prescriptions early. A lot of requests for medications such as salbutamol, especially for those patients that have not ordered the inhalers for a good few years or not attending their annual asthma reviews, and suddenly they're all just requesting it because of the fear of developing advanced respiratory symptoms. And weirdly
so you've got patients that haven't had any inhaler for years and now they're wanting inhalers. that obviously adds a lot of pressure to what you're already doing, doesn't it?
It's already added to the workload. We had to seek advice from my local management team from the CCG, because they wanted to know what kind of workload that we are experiencing. So that was one of them, as well as questions about ibuprofen, ACE inhibitors, and ARBs. That's been hitting the news lately about potential contraindication with the COVID-19 virus.
I just want to ask you something, because obviously every time we hear something works on this COVID-19, people start rushing in to buy order that. That can't make your life any easier, can it? Because first we've had everyone's running around for hydroxychloroquine, not getting private prescriptions for it. I mean, how does it affect your work, and how does it affect the people who would normally use that medication for other conditions?
Well, for us, I think the spread of misinformation, fake news, and also there's a lot of views from the medical sides, both giving conflicting advice. So even us healthcare professionals, we don't know, like, is it true? Is it not true? And also, we're reading exactly what the public are reading. And you got arguments on good sides from both sides in the medical field regarding the hydroxychloroquine, of the use of ibuprofen, to take it, not to take it. So I mean, we're just as confused, which is why we're seeking advice and guidance from a local medicine management team, and who in turn, like for example, the salbutamol early request, and they spoke to the local respiratory team, who say that during the pandemic crisis, it's probably a good idea just to give one salbutamol inhaler in the meantime, but do not issue any corticosteroid inhalers, or even the rescue packs that's been doing the rounds on social media as well, where a non-clinician incorrectly posting messages to for patients that have both COPD and asthma to get antibiotic and prednisolone rescue packs, which is not common for asthma and is only suitable for certain COPD patients. And also the fear of using steroids, which may
I think
worsen the immune system.
one of the things that exacerbates
this virus. But so it's I think that the fear alone, as well as I think too much information is not that good either as well. And there's a lot of credible sources, which I said earlier, that are both good and for and against. That's confusing us healthcare professionals, not just as pharmacists, even the doctors, the nurses, the medical profession. Like, who do we trust? Who do we believe? And it's such a rapid pace. I mean, every day is a different day, and obviously patients are reading pretty much the same thing because everything's being made available online, and that's obviously adding to our workload as well. In addition to getting the repeat requests, so we're having to take time out, dig into this research, get some verified sources, and then relay that information back to the patients, and then tell them that not to spread these type of rumors to all the other friends, families, relatives as well, and to help us do their bit as well to stop the spread of misinformation. And of course, all of that does take time, and obviously we're having to confer with just in general practice also community pharmacy colleagues as well, because they're all getting similar queries, I'm sure, as well on the other side.
Yeah, I mean, I've been in self-isolation for the last 2 weeks, coming on to the second week now. So I've been keeping in touch with everyone else. And before I went on self-isolation, we didn't really, from where I was working, we didn't have that many customers coming in. But I know the other neighboring pharmacies, they had a lot of queries. They were packed out. They didn't have any break. Just crazy at the moment out there. And obviously it's progressively gotten worse. So which we're hoping when Sham Kiani comes up next, he'll be able to tell us a bit more about how it's affecting community pharmacy. Obviously he works in a small village out in Gloucestershire with a lot of elderly population. So he will be able to tell us a bit more about the effect of that demographic is having on his supply issue, on the scripts, the type of scripts that he's getting, and how it's affecting us generally.
The issue that I've seen, that obviously we've got a community pharmacy across the surgery, and I can see the lines already queuing up from 10, 11 o'clock onwards. not just because of the early request, but also you've got to maintain social distancing. So the customers are being left to one or two customers at a time as well. And obviously, there's a lot of queries and patients, they're struggling to even, they normally order the repeats by phone because we've got a lot of elderly patients, and they're struggling to even get through to pharmacy for days because the phone's always engaged. And then they're having to contact us at the general practice. So in front of we try to keep clear for patients that need to speak to a GT doctor for triaging, etc., if they can't get the right answers from the NHS 111 service. So obviously, it creates workload issues for both of us, and it's trying to educate both the patients and also the public, like the amount of workload it does take. And also, I think the other thing about is staffing issues. If the staff are having to self-isolate as well, it's reduced staffing capacity, whereas the workload normally gets like a week's worth, and the patients are expecting to be done within a day or two, because that's the amount that we've been queries that we've been receiving over the last week alone. And of course, the reduced staffing causes a backlog in prescriptions being done. Also, it's only recently that the GPAC has allowed pharmacies to have up to 2.5 hours to close the pharmacy to catch up, but I'm not even sure if that's enough at the moment, because then you're also expecting some of the medications to be delivered to patients, especially for those patients that don't have nearby friends and family that help collect their medications for them. So I
think that's one issue I want to pick up on is the delivery side of things. Obviously, the government has cut a lot of the funding, so that's caused a lot of companies to now stop delivering to patients. Especially, this is obviously going to affect everyone, because it's better to deliver than for them to come to the pharmacy, pick up medication when they're infected.
But you got to remember, most of the pharmacy delivery drivers, they're at an age group where they're mainly
well, a lot of the delivery drivers are actually people who have retired and they come on to do this kind of a job afterwards. So obviously a lot of them are now out of work because of the COVID crisis, and they're obviously at risk. So there's less of them around. How do you think that's going to affect the elderly population in your area?
Massively, because as I said, we do have a pretty elderly population as well, and I think the public generally expects it that pharmacy to be done as part of the essential services, but where you and I know it's not funded by the government. If anything, we're getting funding cuts, and also with this increased demand, especially with self-isolation, then the demand for delivery is greater than ever before, in addition to the reduced staffing, the increased workload. So I don't know where funding is going to come from. I know today the NHS Matt Hancock announced that NHS volunteer system where they're going to register volunteers, and even that alone causes question, especially if they're not DBS accredited and to deliver medications if they're not.
Yes, I mean that brings up another scenario.
So I know it's the pandemic crisis and we might have to get rid of some of the red tape, but at the end of the day, it's not that delivering shopping, and medications is something that
I mean, this I think is going to be a difficult one, because if you've got anyone and everyone coming in volunteering, which is great, obviously it helps. But the fact that we're delivering medication, we need to do DBS checks. We need to ensure that they don't have any criminal records, and the medication will be diverted, especially from people who are vulnerable, and it could be life-saving medication for them. How do you think that's going to affect? Because if your delivery drivers are falling ill and you've got no one to deliver, and you don't really have much of a choice and they can't come to you, how do you see that affecting the flow of medication to the patients?
I think that is a big concern as well. I think people realize that, especially those very vulnerable high-risk patients that are being told to isolate and keep away from face-to-face contact for up to 12 weeks. So the need for delivery is greater than ever before. I know it's still not been finalised. I think there's still discussions ongoing, which may take up to 2-3 days to resolve. I think probably by Friday at the latest, there'll be a service in place. So it'd be interesting to see how that happens, because it's not just the funding that we need; it's also qualified manpower. Because as I said, it's not a typical volunteer that can, with all the good intentions, we need to verify the criminal record checks, etc. Because some of the medications could be high risk as well, could be controlled drugs, and these are drugs could be that are prone to misuse and abused. So there is a fine line, in terms of helping out the vulnerable patients, but also keeping our patients safe, and that we know that they are going to be delivered as they say they are. So it's again, I appreciate that it's a lot of things are happening in such a short space of time, and as I said, every day is a different day, and obviously the number of deaths, unfortunately, is growing day by day, and the workload is going to be increasing. There's no getting away from that.
So just to interrupt you, sorry. What would
Yeah.
your advice be now to all those pharmacists out there who are listening in, working in community pharmacy, whether they're working in GP practice or hospital pharmacy? What would your advice be to them?
Well, I think, as I said, a lot of the queries that we're getting, I think people are over ordering, so it's not like they need it right now. So I think we need to exercise caution, just sort of give ourselves a bit of breather. Not rush where you're more likely to make mistakes, especially if you're on reduced staff as it is. Keeping calm as much as possible. Having in our practice, we normally have like a 15-20 minute break where all the staff just unwind, share what our feelings, thoughts and feelings are at the moment. Because I think mental well-being is just as important for both the public as well as the healthcare professionals, and we do need to air out our grievances, and that does help a lot as well, and as well as just
I think mental health is one that not many people have touched upon at the moment, with pharmacists being super stressed. I was speaking to Sham before in Gloucester, and he was saying, look, it's like Christmas, 10 Christmases rolled into one times 10.
Remember Christmas, when the dates start and finish, and so you sort of have that mental preparedness that it's going to be busy, and you're mentally and physically prepared for that. Whereas here, it's just sprung on us, and we weren't prepared to have practically total lockdown and self isolations and increased demands and panic, etc. So
and then we've heard recently that some companies are closing on weekends. That will obviously increase the workload. I understand there were, I think, was it Lloyd's Pharmacy that was saying they were looking at closing, or was it Boots? One of those companies were looking at closing on the weekends. That's obviously going to affect the whole supply chain a lot more, because you're going to have now everything that you can done on the weekends, that will now be done on the weekdays. So that will put pharmacists and the pharmacy team under even more pressure.
I think, I don't know about the multiples. I know like a lot of the independents, they're literally coming in their own time, whereas after hours, more likely to come during the weekends. If the pharmacies are normally shut during the weekends, or they work at reduced hours and weekends, then also while the pharmacy is shut to the general public, those guys are coming in within their own time, not just the pharmacy owners, but also their employees, staff, etc., come in their own times, away from their families, just so they can catch up on the workload and get the farms prepared in readiness for the week ahead. And I think that's going to happen. And I'm not sure if the multiples are doing that compared to the independents. They might be doing that. I don't know what's happening behind the scenes. So it'd be good to get the viewpoint from an employed pharmacist or existing pharmacy manager to see how they're coping.
Yeah, well, hopefully we'll try and invite more people into this podcast and get some views from other pharmacists, both employed and in different parts of the country, working in different sectors, because I think we need to get a feel of what it's like for everyone. We've got to get some.
I just want to give a shout out to for those pharmacists, especially those that are working across many sectors. A lot of them have volunteered at their own time to come into the community pharmacies to help out with the workload, me included. So and kudos to them, and I think the numbers are growing, and I think it's quite
absolutely. I think, to be honest, everyone that's volunteering at the moment, putting the life at risk. I mean, we know it can affect pretty much anyone from healthy to the elderly. Everyone is at risk at the moment, and those that are volunteering, risking their lives essentially.
Especially the mask apron is not great compared to what obviously you see in the frontline hospitals, and even then with a lot of farms, they are running out of equipment as well. So even for myself, I had to luckily, my dad's in Bangladesh, and someone else was traveling from Bangladesh to the UK a few weeks ago, and he managed to bring in some the high quality masks and sanitizers in. So I'm able to use that in the meantime, which are reusable after you're washing them. And I'm to my surgeons are also having to fork out with their own funding to get scrubs, just so all the staff are getting daily clothes being washed in and reused for the next day or two, just so we don't
Yeah,
run
I
out
mean,
of
the
COVID.
PPE. I know a lot of people are they're struggling everywhere. The whole NHS is struggling at the moment, and I've looked seen in Spain they're turning Zara's turning their factories into making protection clothing for the doctors and nurses, and I think they're doing same in Bangladesh at the moment as well.
Yeah.
They're making masks and scrubs for everyone. Um, are you getting any kind of PPE for when you work in the surgery? Do you see the patients, and are you wearing any kind of protection at the moment, or are you just seeing them as you would normally?
No, I feel myself and a lot of the GP practices, we're now actually doing just purely mainly telephone or video consultations.
Okay.
We're in a fortunate position where we can stop patients coming to the surgery, and we're utilizing technology a lot more now. And obviously, there's still a certain few patients who are sick at the end of the day, and they don't have respiratory symptoms similar to the COVID-19 virus, that do need to be seen by the GP. So they are being triaged by the duty doctors, and for those patients that do need to be seen, we are heavily regulating how they come into the practice through the side door, through the passageways away from the reception area, and all staff when they taking the patients from the side door into the doctor's room, they're all wearing masks and PPE equipment, but the equipment that is running out at the moment. But fortunately, we're not seeing as many patients face to face compared to a couple of weeks ago, and we are again in a fortunate position in general practice where we can consult with patients by video and by telephone, whereas in community pharmacy, it's very unlikely that patients are being stay away. To be honest, a lot of them are being told to come to the pharmacies for advice or to get prescriptions if they don't have someone to deliver the medications for them. So it is a different setting, and unfortunately, the PPE equipment is not up to standard, and it is running out. So I'm not sure when the next stock is due, and that's what pharmacists are being concerned about, is actually lack of PPE equipment, as well as even being close to other staff members as well. As much as they want to obviously have that 2 meter gap, obviously if you're good dispensing and checking prescriptions, you are going in and around anyway. Because a typical community pharmacy, they're not big, so so that is a cause for concern as well for some of these staff that I've heard in the community sector field.
So that was Siddiqur Rahman in Kent. You've heard how it's affecting the GP surgery pharmacist, and this is from speaking to pharmacists around the country. Working GP practices is similar everywhere, and our colleagues in the community pharmacy are facing just as difficult situation, if not more, because they're getting inundated with prescriptions. One colleague I spoke to yesterday said it's like Christmas 10 times all in one day. So it's a bit crazy. And this is a time when we really need everyone to come together. I've been hearing a lot of locum pharmacists getting threats from companies when they want to negotiate a fair rate. Obviously, in these kind of situations, we do ask everyone to be cautious. It's a difficult time, and no one would support profiteering, just like we wouldn't support someone selling paracetamol for £20. We wouldn't support a locum pharmacist charging £100 an hour. Saying that, I don't think it's an excuse to cut wages and cut rates to improve profit and save money. by some of the companies as it looks right now. We both need to be fair and work together. Ultimately, our main concern is our patients, not saving a few pounds here and there. It doesn't look good for us, and ultimately, if you don't have the support of your pharmacist, you don't really you're not really supporting your patients. You need a happy pharmacy. You need pharmacists that are looked after, and that can work at their best, and not be harassed and threatened for asking for fair rates. I mean, ultimately, they're putting their lives at risk. Literally, this is a serious pandemic where a lot of pharmacists have gone ill, and a lot of pharmacists have lost their loved ones. So they're rightly scared. So I think we need to be quite cautious instead of just threatening them with GPAC fitness to practice or blacklisted from the companies, as I've seen in some of the emails. This is really not the time for that kind of attitude towards pharmacists. And obviously, pharmacists, what I would say too is, think long and hard. These are difficult times. Our patients do need our support, so we need to also be cautious and not. I'm not saying anyone I've seen is profiteering in this crisis, but I think we need to consider the amount of risk that we're taking and what that's worth to us as professionals. But ultimately, if you want to support the patients, the NHS does need a lot of pharmacists right now. Go ahead, support the pharmacists, support the NHS. I think they do need and appreciate the support that pharmacists can give in these crucial times. So this is the end of episode 1. I hope you enjoyed it. I hope you found it useful. And I hope you do keep giving us more feedback on the podcast itself and what you think we should add, what else we should cover. And also, please do join the Pharmacist Cooperative. We've worked for 3 years to build up this amazing network of pharmacists. We have around 10,000 at the moment. And look at everything that we've achieved, the support that we've given, the clinical support groups, the student support groups, locum support groups. They've all been there to help everyone. If you have benefited from it personally, please join. It's only £20, less than an hour's wage for most people, for a whole year as well. And if you haven't directly benefited, just think about what a strong, unified voice can do. Look at what it's done in the last couple of years for everyone who's been on the network. And if we all get together, I mean, this isn't just for locums, this isn't just for pharmacists that work in community, it's for everyone. The more people we have from the diverse sectors, the more it strengthens us. We are only for pharmacists, and one thing we will never do is add a non-pharmacist to the organization. It's always been pharmacist run, for pharmacists by pharmacists, and we're not here to take over any other organization's hard work or name. We're here to support everyone, and the aim is to unify the whole profession and all the different sectors and speak for pharmacists. So yeah, please join, and if you want to volunteer will help us make the organization bigger, you have some ideas, get in touch. We're always open to ideas. In fact, what makes the whole platform great is that we are open to everyone, and we listen to everyone's voices. Your opinions do count. So yeah, join. Hope you enjoyed the episode. We'll have some more exciting interviews over the next few episodes as well, and we'll try and go international too. So yeah, looking forward to that one. See you soon.